Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. This channel is dedicated to amplifying the voices of doctors, other healthcare professionals, and patients as they share their unique struggles, triumphs, and passions. My mission is to build connection and create advocacy for healthy doctors, driving positive change that benefits both doctors and patients. This is a space for everyone who cares about the future of healthcare. If you appreciate this content, please like and subscribe now. It really helps the episodes reach our target audience. And I'm thrilled to welcome Dr. Jessi Gold and Cheryl Stumpf. Thanks for joining us today, Jessi and Cheryl.
Thanks for
Hi,
having
thank
us.
you.
You're very welcome, and I'm super happy to introduce you to each other. I love this. Is so many times our guests have never met, and that's the case here. And then we end up having a fantastic conversation, and I have no doubt that's going to be the case today. And by way of briefly introducing you both, Dr. Jessi Gold is a psychiatrist, chief wellness officer, and mental health advocate in Tennessee, and best-selling author of How Do You Feel? And Cheryl Stumpf is a licensed professional counselor, EMDR certified trauma therapist, certified yoga teacher, and an ambassador for the Dr. Lorna Breen Heroes Foundation. And today we'll be talking about how I met Jessi following her powerful presentation at the New York City Burnout Symposium last fall. And then the very next week, I had a call with Cheryl, who reached out to me following our quarterly Dr. Lorna Breen Heroes Foundation Zoom. And Jessi is also involved with the Dr. Lorna Breen Heroes Foundation. And are either one of you going to the event next month by chance?
Oh,
See?
I wish I could. I can't.
Okay.
I'm what you call a person who should practice more of what they preach and say no more. I'm not going, but I still should say no more.
Yeah, right. I believe that. But you'll be happy to know, Jessi, that just a day or so ago, I interviewed Dr. Deval Desai and Wayne Sotil, and Deval is going to be there. So I'll get to meet him in person, and their episode will appear just before yours. So I think that's all very exciting. And you're both mental health advocates supporting healthcare clinicians.
Yep.
And Cheryl provided trauma relief in the Boston area during the pandemic. And this year, I want to raise awareness about trauma-informed care for physicians and offer hope. And I had Doctors Stephanie Byerly and Dr. Andrea Austin on recently speaking to this. And I'll also be interviewing Dr. Kimia Serif and Dr. Michael Hirsch. And I'm looking forward to you sharing your unique individual perspectives today. And I would like to start by asking what you'd most like our audience to know about you. Jessi, would you like to go first?
Sure. I mean, I think that what I would most want people to know about me is that I am a psychiatrist who sees healthcare workers, but has also been a patient myself. I have had burnout. I take mental health medication. I am aware of all of the reasons why it's hard for our group to seek care. And I hope that by seeing that group as patients, that I've been able to incorporate both what I know as a clinician, but also what I know as a human into what I'm doing. A lot of that interest has led me to some of my writing, which is where the book came from, and some of the just sort of general population advocacy that I've done, but also my new job, which is Chief Wellness Officer for the University of Tennessee system, which is all 5 campuses of the University of Tennessee. And I have the ability to kind of look at this as a system and look at it as a person and a human and a clinician. So I have a lot of fun, different levels to interact with that. I like stupid TV, Taylor Swift, and my dog. If that also helps you not think that I'm completely defined by my job, because I'm trying to not be.
I love that you share that. Thank you. And I love that you're willing to be vulnerable and share your story because I feel like a broken record, but I say so many times every time a doctor shares their story, another doctor feels less alone. And that's 100% true. And it's so important. And it also adds, even though you wouldn't choose to have had struggles, right? Nobody does. It absolutely adds a depth to your understanding and your work with your patients. So I'm sure you and your patients are grateful for, your broad and deep experiences. And so thank you, Jessi. And
Of course.
Cheryl, yeah, what would you like us to know about you?
Well, I feel like Jessi and I are kindred spirits, so we're just meeting for the first time. But before I say anything, I just have to say this. Kim, you make my mental health go up exponentially whenever I'm in your presence.
Thank
Um,
you.
so, yeah, I mean, I want to echo what Jessi said. My journey very similar. It's a thin line between therapist and client. And I think that it is really important for us to be real about what our struggles are. I am also a recipient of a lot of therapy post-pandemic. You know, when we were in the pandemic, I was treating people, and my story is I'm an EMDR therapist, and I've been using EMDR for years, but never did I imagine doing it in a virtual format. And during the pandemic, I was recruited to work with the Boston Area Trauma Relief Network to provide relief for healthcare workers. And never did I imagine the impact that it had on my colleagues so that they could go back in the trenches again. They were watching people die. They were caring for the caretakers. They were caring for everybody but themselves. And that also, that coincidentally is the time frame that Dr. Lorna Breen was working hard and took her life because she wasn't getting the care that she needed and deserved. So during that time of serving healthcare providers, I just had this epiphany and just wondered, why am I not doing this for myself in my own private practice? I was working in a university counseling center at the time, and it was a game changer for me. And I decided to pivot and launch my private practice with an emphasis on treating healthcare workers. And it has just been so life-giving and has allowed me to just kind of pay it forward. And also, just like Jessi, I'm not all about my work, although I love what I do. But I am very family oriented. As you said, Kim, I'm a certified yoga teacher. I have a daily yoga practice. I meditate. I have a wonderful family. One of the things that I especially love is when my kids call me once a week to let me know that they're alive. And I have a Boston Terrier who is a very needy dog.
Mine's a Maltipoo. She's also
Uh,
needy.
Oh, well, thank you. Here's to dog owners of needy dogs. Is there a support group for that? No.
Probably.
yeah, there probably is.
Yeah. Something else you have in common, right? And Cheryl, actually, you're going to be moving down south, right? So maybe,
I am. Yeah, I'll be moving to Alabama. So I'm looking to get licensed down there. I'll keep my license here. But hopefully, I won't need to work so hard on licensure because we're waiting for the compact to go through for licensed professional counselor so I can practice across state lines.
yeah, well, that's fantastic. And Cheryl, I definitely want us to touch on EMDR because a lot of people don't know what it is or they've heard of it and just don't
Yeah.
understand it. But before that, I thought something you shared with me as we were planning for this conversation. I was going to read your quote and let Jessi kick off the conversation, and then you two can feel free to go back and forth. And Cheryl said, "We're experiencing a loss of too many of our great colleagues, either to suicide or leaving the field because their mental health was significantly suffered. We are all at risk of having the important work we do affect our mental health." And, you're both examples to that. And this is especially true for those who care the most.
Yeah, I mean, that's all very true. I mean, it's sad that it's true, but it's true. I think we enter the field as people who care about people, and part of the reason we do these professions is because we want to help people. And, in medicine in particular, you're then stuck in a culture that puts other people before yourself all the time and makes you feel like it's selfish to have reactions or feelings or emotions, and also like you're going to lose the competition and someone else is going to beat you because you're having reactions or vulnerabilities. And so you see modeled not a lot of feelings, you see modeled not a lot of care seeking, and then you hear a bunch of pretty negative stuff about people with mental health challenges that also kind of filters in the air, and you go, well, I don't want to be that person. And so, you're pretty much set up to be in a pretty like silent situation about what you're struggling with, and you're also really set up to feel like it's somehow your fault if you're affected by your job, when it doesn't make any sense that that's true, because it's the air that we breathe, the things that we hear, the stuff that we see is hard. We should be approaching it like the chance that we're affected by it is 100%, and it's not our fault if we are. And instead, we should be preventing it. We should be comfortable asking for help around it. We should be in a culture that understands that. And I mean, I hope someday we get there. It's a slow process, obviously, but I think there's some signs that we're heading there a little bit more with, the pandemic did, if anything, really thrust this conversation into the forefront and like not as much in the shadows, and people couldn't ignore it anymore. That's not to say that we were good, the pandemic came and then we were bad, because we were bad, the pandemic came and we were worse, but and it doesn't go away, but it did definitely make people like less likely to be able to shove it down, or less likely to be able to not notice what was going on in their systems and with their colleagues and with their sort of like teams. And so it was definitely more talked about. I don't necessarily see that as much right now, so I'm kind of like sitting here going, I hope that it wasn't a temporary blip and that people went right back to silence. And I think organizations like Warner Breen, but conversations like this and people like us who really care about this are trying to have that not happen as much as possible too. So
Yeah, as Cheryl responds, I did want to speak to what you said, Jessi, about like everyone doing this hard work needs support and should get support. And I've often quoted Dr. Joe Sherman. He was one of the early guests on this channel, and he said, when you have to fill out those questions, that to reinstate your or to maintain your license, if it says if you've ever support mental health support, the next question should be, and if not, why not? And I love that so much. So Cheryl.
Yeah, yeah. So yeah, I agree about, the pandemic kind of was the tipping point, and it just really shed light on what has been happening for a very long time. Um, eh, what is done to us in our training? First of all, I this idea that we should know how to access help, or we should know better. It can be very shaming to have somebody say that to us. Um, One of the things that has always been offered up on our job, in any job that I've been, is EAP, employee assistance program. But no, it's almost like a pat answer. Well, did you call your EAP? Rather than having a hard conversation about why you would need the EAP and what's going on with you. And so that has driven me, um, to just really change things. And I really like, Jessi, how you talked about the culture shift, and how there's this groundswell now, and especially with the Dr. Lorna Breen Heroes Foundation. I'm just so excited about the potential, the possibilities. Shifting to, do you want me to talk about EMDR therapy?
Sure, go right
Okay.
ahead. And just explain to people what it is and how it helps.
Yeah. So EMDR stands for eye movement desensitization and reprocessing. And that is a very big term um, for changing the way that we think about ourselves. So when you think about, there's a really great book called The Body Keeps a Score. It's something that many people have read, and Bessel van der Kolk really nailed it when he talked. There you go. He nailed it when he talked about how we hold trauma and adversity in our bodies. And when we use EMDR, it's okay, let's break that down: eye movement desensitization and reprocessing. We're really talking about helping the brain to calm down, or the central nervous system to calm down. It's not about getting rid of the emotions, but it's about helping us to tolerate it while we bring the thinking brain online. So we're occupying the same space. And we're taking that experience that has been traumatic or adverse, and we're helping the client to make new meaning of it. Now, with regard to the early trauma and adversity interventions that we use with when we were treating people during the pandemic, these early intervention protocols were about capturing that traumatic experience before it moved into consolidated memory. So we're really trying to digest it and break it up and help the brain to do its job. If you think about if you had a broken foot and a doctor told you keep on walking through it, it'll get better, that doesn't make sense. And so that's why we want to navigate our providers or anybody who has an adverse experience to pause. Let's remove that block, whatever is interfering with getting the treatment that you need so that you can move through healing and take care of yourself. So the EMDR has many different protocols that we use, and the early intervention is what I use with healthcare providers. In fact, I want to put a little plug in here for an initiative that I'm working on. There's a colleague of mine in Canada who just developed her brand, which is called Shift Change. And shift change is all about helping people not only to shift the way that they're thinking about themselves in this adversity, but also making it possible for our healthcare providers to take care of themselves in between shifts. And we are offering relief for our providers in between shifts. So we're making it possible for them to meet with us in this virtual platform anonymously. And we figured out a way for these providers to not see each other, but they can see us and we can see them, and they don't have to worry about their anonymity. So I'll give you some information. You can put that on in the comments, Kim.
I absolutely will. Well, thank you so much. And Jessi, anything you want to respond to what Cheryl said? Three things that came to mind that you're both speaking of is Jessi, you brought up, and then Cheryl did too, is shame. That is like huge. There's like the shame that you and stigma that you feel about it, or you think other people would be projecting on you. But then there's just that internal built-in self-shame that compounds it, whether or not the perceived shame from other people is even real. There's that self shame. And then I like the way I believe it was Cheryl speaking about the upstream issues. Not just talking about what's happening right now, but what's causing these issues in the first place, instead of just taking the people out of the that are drowning at the bottom of the stream. You got to go upstream and find out, why are we having these problems to start with. And I also liked your broken foot analogy with to explain EMDR. So thanks. Go ahead, Jessi.
Yeah, I mean, I think it's important. Like, I tend to see people when they're pretty sick. I mean, I'm a psychiatrist, so it's skewed a little bit just for that. But I think that we don't notice that we're struggling until it interferes with work or somebody tells us that it is interfering with work, right? I think we wait a really, really long time, in part because we can do work like robots. And so we're like, a rest of our life is messy, but work is not. And so we're fine. And that's all we're doing. And we go to work and whatever, we're ignoring the rest of our life, even though that should be part of what we're thinking about too. And, with that as the barrier, like, when we work through everything in medicine, like I have heard stories of people miscarrying on the job, like waiting until their actual, like, water breaks on the job, people who are like dragging IV poles and throwing up. And, people think that that's a story from the 70s, and all those stories are from like yesterday, right? So, our barriers for even like not going to work are so high. So I think it's important when we think about this, that when we think about upstream, that's also us recognizing our own needs earlier and valuing them, because we have learned so long to not eat, not sleep, not pee. Like, why would we feel, and why would we at all recognize that we have like emotional needs? And we need to, because of all the stuff that you're talking about. But you could change the electronic record, but we could still hate it and not deal with anything until it affects our job. And so I think it's important that we have some ownership over that and that we recognize, like, yes, the system is broken, but the system affects us and we can control like what our reactions are to that. And when we ask for help and how we value that help and how we like prioritize ourselves in the equation. And that's something I've had to learn. I mean, I broke 2 feet, speaking of broken feet, in the course of like 6 months. And because of telehealth, I didn't miss a day of work. And I showed up and in crutches, and my patients were like, "What's going on? When were you in crutches?"
Wow.
I'm like, "I'm in crutches the whole time." And they were like, "Oh, you didn't." And I was like, "Yeah, I didn't." And it was like almost like I was proud of myself for it. And,
Mhm.
that's not the only time it's been like that. In residency, I got sent home from a nurse, not my attending, for basically having a fever and coughing and wearing a mask, but you could tell it wasn't a good thing. And someone had to like actually like basically carry me out of the hospital for me to leave because I didn't think that I could. And so, like, if our limits for physical health are mostly ignored and also so high for illness, like mental health doesn't fit that very easily either, and we don't recognize it very well. And so, I just think it's important too when we think about something like EAP or whatever that, we're thinking about it not just as a crisis intervention, that we're recognizing that you could ask for help because it makes you better at your job, not just because you're at a crisis level, that you don't have to wait to be in a crisis to go,
Mhm.
this matters. And I think that like EMDR is the same way. We hold trauma for a very long time and we don't even recognize or call it trauma for a lot of the time. And if you wait until that trauma is interfering with your life, it's probably much more severe than it needed to be. And so, being able to sort of recognize like our life stories impact our like work and that we're allowed to ask for help is a big part of this too, as much as systems changes, I think.
So I want to jump in on what you're saying, Jessi, and it's so true. We can't ignore the fact that we are humans and we have stuff that feeds into what is going on currently. And I was just thinking about that idea of persistence, and you highlighted how we as practitioners just persist and we keep pushing through all that adversity to provide care for others. And why is it that we don't persist and insist that we receive the care that we deserve after putting out so much of ourselves? And the question that often comes up, when I'm working with my clients is, what does this mean about me if I have to take time out to take care of myself? And so we come up with shame. We come up with historically what has happened. Were you blamed? Were you made to feel responsible for somebody else behaving badly and responding badly? So there's a whole set of circumstances that somebody is coming to the table
100%. And going back to what Jessi said, or that you're both saying, is don't wait. You don't have to wait until you're in a
with.
crisis situation. You shouldn't wait. If you're not feeling your best, you'll get help and you'll feel better. Like there's real help out there. There's real people that care, and also not to wear your suffering as a badge of honor, right? And Jessi, I have heard those stories from doctors and sharing stories about, them going to work sicker than any of their patients and literally that day ending up in the ICU with a pulmonary embolism. And these are real stories from, real doctors.
Yeah, it's embarrassing. I mean, it's embarrassing a little when you say it out loud because I swear you say it and people go, "That's what they used to do." And you're like, "Someone told me that happened yesterday." And it's just like there's this belief that we've shifted so much because we are more open and we do talk about this stuff more. And even just the generations are different in expectations for the workplace and work-life balance and stuff. But if you come in one way, it doesn't mean you leave that way, right? Like there's studies where you come into med school and you say like mental health is health, like it's a valid reason to get help, but then you say my patients are going to judge me for it, my colleagues are going to judge me for it, residency programs are going to judge me for it, and my supervisors are going to judge me for it. So as a result, when they say like would you tell someone if you get help, it's like such a tiny, tiny percent. So it doesn't matter what you believe about yourself because the rest of the world told you to believe differently, and you're really trying to fit in and assimilate and be successful. And that gets in your head. And like, I know that from personal experience because like I didn't even realize I stigmatized myself for being on medicine until there was this time right around like, early 2020 as a result of Lorna's death, where a lot of people were speaking on social about their experiences with mental health and healthcare and various professions. And, I said something about going to therapy and also how psychiatry as a field is stigmatized. And I was like, oh, that was a good post. Good for me. And then I started reading everybody else's, and I realized so many people were mentioning medicine. And I was like, wait, like I've been on med since college. Like, did I purposefully filter that? And I don't really believe you owe anyone your story, and there are parts of your story you don't need to share. And like you don't, you could say you have trauma, but not why, right? There's so many ways to filter what you share, and you shouldn't owe that to anyone. But I'm a pretty authentic person, and so when I sort of like was paying attention, I was like, I think I'm doing something on purpose, or my unconscious is, and so I, brought that with me to my therapist, and kind of when I answered the question, like if people knew I took medicine, it was like they'll think I was sicker at one point. They'll think anytime I have emotions, I'm going to crack, and patients won't want to see me. Like, and I had no idea that was in there because I spend all day telling patients who are healthcare workers that it is totally normal to go on meds, that it's the same as hypertension medicine for blood pressure, like that if you had a broken bone, you'd fix it. Like, I believe that too. Like, I'm not lying to them at all, but I was lying to myself, right? Like, in there,
Mhm.
because of training, because I went through the same training, I had a lot of the same beliefs that I had no clue I had because, like, they are incongruent with what I project to other people and their lived experience, and really incongruent to my beliefs about everything. But when it like turned out I was applying it to me differently, like that was really important for me to realize because like I made me realize that probably everybody has that in there somewhere because our culture kind of starts without healthcare culture, your personal culture, what you see on TV and movies, all that stuff, and then it gets compounded by healthcare. But that like I still had that made me worried and made it something I needed to think about. And I think that we all kind of can get swayed by what we're around and what we see modeled and what we see valued and what we think matters, even if deep down a lot of the people we're around are getting help just not talking about it, or they believe something different, they're just not talking about it because no one is. And I think that silence part and that lack of role modeling and the lack of vulnerability in the workplace like does make a big difference because not everyone needs to be like, hey, what's up, I'm Jessi, I take meds, I've been burnt out, like all that, like like somebody does. Just like we need these examples, just like celebrities need these examples of like people that are in leadership and doing okay and got help. But we also just need people to be like, it's really weird we aren't allowed to pee, isn't it? Or like, you're sick, you should go home. Like whatever it is, these just like very obvious things that we don't say out loud, but we're all thinking, but we're thinking them alone. And so we think we're alone and then we blame ourselves. And it's like this whole big thing. And so I'm really big on like, what can we say out loud, even if it's obvious? Because, like, it's very lonely when you think that you're the only one who notices how weird some stuff is or how broken some stuff is. Because then you just get mad that somehow you're not dealing with it correctly. And that's not fair because most of us don't like healthcare system, don't like the EMR, think it's ridiculous that we see people die and then go eat lunch. Like, whatever. I could come up with a million different things, but none of us think that's good. But we don't say it out loud because we're like Fight Club or something. And I'm not a big fan of healthcare as a fight club as much as possible.
Yeah, I want to say something about the anger. Thank you for bringing that up because the point that I ended up in therapy after the pandemic was, I first of all, I didn't even realize, because I did participate in some of the work that we were doing because one of my colleagues said, I think that you should, partake in what we're offering. And I did. And I'm like, okay, I'm good.
Mhm.
But, then time went on and I found myself getting angrier and angrier with the system that I worked for because they were not taking care of my colleagues in the way that I thought that they ought to. But I don't know what the right thing was. But what ended up happening was, and because I was getting so angry, it was just eating me up, and it just started compromising my own mental health. And when I was able to finally participate, and I found a great EMDR therapist,
Mm.
and I took care of myself, and it gave me some perspective, and it also empowered me to realize what I'm doing now, and that is going on to treat other healthcare providers. And it empowered me also to have these really tough conversations and challenge the systems in which people work. And that- do I not get angry? No, I still get angry, but it doesn't have to consume me. And I think that, there when we get really angry to the point that we feel disempowered and helpless, that's not helpful either.
Hmm. Yeah, and as Jesse responds, a couple things that what you're both saying is bringing up to me is that I'm the only one because I talk to so many doctors and they just all say the same story, like things that they were thinking, or I thought I wasn't cut out for this, right? And this and that. And it's like everyone's story is unique, and but then everyone's story is in some ways the same.
Mhm.
And if we could just, make that obvious that you're not the only one, whatever you're thinking somebody else is thinking it too, like 100%. And also, when you were both speaking about anger, is lots of times it's figuring out what's under that anger, right? Like the pain, like there's other, if anybody doesn't know about that feelings wheel, right, that has all those emotions and feelings and what you might call anger. It might be surfacing as anger, but there's probably a lot of emotions, under that, which you could both speak to better being psychiatrists and therapists. Um,
Yeah,
so as
lots
we
of
wind,
fear.
yeah,
Lots of
right,
fear
fear.
can,
Yes, I think fear is underlying
yeah,
anger. And as we
Yeah,
go back, one more round with each of you, Jesse, whatever you want to speak to this, and also if you wanted to
sure.
share anything about your book, like
Sure.
what your book is about, why you wrote your book, things like that.
Sure. I go to anger very often. So I want to validate that for people because I actually find that anger for me is like when I feel overwhelmed or like too much, the anger is like, I can't do this. It's like an expression of like, no, thank you. And I didn't always value that as an emotion or recognize it. And I was more concerned with sadness and worry, like so many of my patients. And so anger tells you a lot, and I like it as a feeling, but it is also something to like notice and understand and pay attention to. When we're talking about this feeling alone thing, like that's why I wrote the book, right? So I felt very much like all of my patients were saying what you're saying, which is like, I've never experienced this and I'm alone and nobody, and everyone was saying similar stuff. And at the same time, I was burning out and experiencing the same stuff. And I was like, well, we're definitely not alone because I'm experiencing it. And then all of my patients are saying very similar things with different stories. And, maybe this information isn't tangible to them in the way that they want it to be. Maybe they've been having lectures and they're sick of the lectures, and maybe they shut out and think that they're stupid and they don't help them. And maybe they feel blamed by the information. And maybe they could approach it better if they got the information in stories and in a different way. And so, that's where the impetus to write the book really came from, in part, like sort of wanting people to feel less alone, but also recognizing that I was experiencing a lot of the same things too. And I think that's important for people to recognize and understand and see that we're all sort of on this spectrum of dealing with our jobs and poorly at times, great at times, affected by them always, and that's okay. And it's called How Do You Feel? And the subtitle is One Doctor's Search for Humanity in Medicine. And, I think that's really what matters to me is like, how do we stay human and do this job? How do we value the human part of us while we're doing this job? Even if we have to circle back and find it, because that happens sometimes and it happened to me, but it is what it is. And I think that that's important. And hopefully, if someone listening would find that helpful, either as a patient to better understand their providers, but also a caregiver yourself in some way, or as a healthcare worker on the spectrum, a future healthcare worker, anything like that, I think it could be really helpful just to kind of think about these ideas in a different way and see it and maybe be able to digest it without feeling automatically angered by it and blocked by it, I think.
Yeah. Well, thanks, Jesse. I love that so much. And Cheryl, any final words that you have for our audience and also how our listeners can get in touch with you?
Yeah. So I just want to stress how important it is to not wait until the crisis hits, because that's often what leads people to therapy, that they have some kind of major disruption in their lives. And so, that persistence is really important, and persistence in terms of taking care of yourself ongoing. When we use these early trauma and adversity interventions, um, that means we do it maybe once a week, once a month. I have some clients who do it every day for a series of days. And they're just tuning themselves up. We know that we have a 90-day window when adversity happens. And after that, it moves over into PTSD land. We want to prevent it from getting to that place because that's the crisis. So I want to encourage people, don't wait until that happens. The other thing that I want to encourage you to do is please feel free to reach out to me. I'm happy to provide resources. And I want to again point you to Shift Change, and it's shiftchange.life.
Yeah, I love that. Thank you. And I'll put any links both of you want in the show notes there, and I'll share on LinkedIn. And Jessi, how can our listeners get in touch with you?
Yeah, I mean, the easiest way is I'm on every social media platform probably, but I'm at Dr. Jessi Gold, Jessi spelled Jessi, or like website's drjessigold.com. And so you can contact me through there for like speaking or just to ask me a question, whatever, that'll go right to me.
Okay. Well, thank you so much. And I love to provide messages of hope. And I love that what you guys share here. You know, there's so much help and hope out there, and you're not alone. And there's so many people to talk to, and any one of us can provide you with those resources. So thanks again for being my guests, Jessi and Cheryl. I'm so happy that we were able to work this out.
Thanks for having
Yeah,
us.
thank you, Kim. I love what you're doing.
Oh, well, thank you very much. I appreciate that. And in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.